Are we making a difference? A guide to monitoring and evaluating dog population management interventions. The International Companion Animal Management Coalition, or ICAM, was formed in 2006. It is comprised of some of the largest international animal welfare charities and specialist groups, all engaged in humane companion animal population management in several countries, with an emphasis on the developing world or global south. You can see the logos of the members on this slide. The aim of the coalition is to discuss our experiences and share data in order to learn how to be the most effective we can be at managing companion animal populations humanely. We also share our learnings and best practice externally, so we may support and engage the wider community to improve effectiveness as a cohesive movement. In the process of our discussions, we frequently found ourselves struggling with the question of which interventions or practices work best and in which context. We are acutely aware that dog populations differ between location and there is no one-size-fits-all intervention. So we must assess the impact of our many and varied interventions. Without impact assessment, we are unable to make evidence-based decisions about policy and practice. With this in mind, we developed Are We Making a Difference? This is a guide to monitoring and evaluating dog population management interventions, with the aim of helping all of us in the business of dogs to evaluate our impact and hence learn and evolve our interventions. It's aimed principally at NGOs and governments working to implement such interventions in the field, but also for funders and academics with an interest or involvement in dogs. The field of monitoring and evaluation is rich with terminology, so it's important that I define the terms we use in our guidance. Firstly, the term impact, also sometimes known as goal or aim. This is the change we hope to contribute towards through our interventions. For example, for an intervention that catches, neuters and returns a number of stray dogs every month in an Asian city, the desired impact of the intervention could be to reduce the density of dogs and improve the welfare of the remaining stray dogs. The intervention may also have other impacts in mind, such as improving public health. The next term is indicators, also sometimes called metrics or key performance indicators. These are the measurable signs of impacts, the things we would see in the dogs or people, or hear people describing if our desired impact was occurring. These really are the core of monitoring and evaluation. In our Asian city example, for the impact of reducing dog density, a suitable indicator may be the number of dogs seen on street surveys. Methods of measurement are the ways data relating to the indicators can be collected. Back to our Asian city example. For the indicator of the number of dogs seen on a street survey, the method of measurement is the street survey itself. This would be conducted once every 6 months, always following the same route along public roads and the same protocol, so surveying at the same time of day and travelling by the same means. By maintaining the same protocol, this helps to minimise any noise in the data, so that any change in the number of dogs can be attributed to a genuine change in dog density. Monitoring is a systematic and routine collection of data relating to the intervention progress, such as how many dogs have been sterilised or vaccinated to date, but also the data relating to the indicators of impact, so the street survey data in our previous example. So monitoring really is part of the daily work. Evaluation is conducted much less frequently, although it should be done regularly to check progress against milestones or targets. It uses the data collected through monitoring to answer questions about what difference did this intervention actually make, and how could we have done it faster or more efficiently. It is also sometimes termed impact assessment. So now we have a shared understanding of our language of monitoring and evaluation, I would now like to convince you that you should care and actually want to invest in this process yourself. Firstly, your donors, whether private individuals or public entities, will want to know their money is making an impact. Secondly, you can inform the public of any impacts on them or their dogs, as they are the target beneficiaries of the intervention. Thirdly, you may want to use the evidence formed through impact assessment to lobby for sustaining, expanding, or replicating an intervention. For those with an interest in a number of locations, for example national governments or international organisations, they may want to compare interventions and their relative effectiveness. But perhaps most importantly, monitoring and evaluation allows the intervention managers and leaders to understand and assess their own interventions and in turn learn from this and improve their impact. Another way of conceptualising the benefits of monitoring and evaluation is turning this linear process, which is founded in assumptions about the dog population and what will work to manage it, into a cyclical process that encourages thoughtful consideration and refinement of initial assumptions. And this provides the opportunity to evolve and improve the intervention over time. In this project cycle, the blue evaluation and learning event feeds back into the initial assessment and concept of the dog population, encouraging the implementers to assess what aspects of the intervention could be refined or improved. It can also provide evidence of change in important impacts, hence demonstrating the benefits resulting from the intervention. And so, with the benefit of monitoring and evaluation in mind, the ICAM Coalition developed the Are We Making a Difference guidance. It's important at this stage to stress that this guidance does not present a set of rules, nor a gold standard for impact assessment. It collates our best yet guidance on meaningful indicators and cost-effective methods of measurement. We hope that you will enjoy reading the guidance and feel inspired to try out some of the recommended and suggested ways of assessing your impact. But we also hope that you will look to innovate new approaches and share what you have learned in that process so that we may keep improving the guidance over time. So a dive into the guidance itself now. It is separated into 8 impacts, commonly aspired to by dog population management interventions. Now we recognise that most interventions will have only 3 or fewer impacts in mind, and I will return to this fact later on. Under each impact we find a list of indicators, potential ways that change in this impact could be measured. These are a mix of recommended or suggested indicators. In the table on this slide we see Impact 1, improving dog welfare, followed by a list of indicators. The first indicator is an example of a recommended indicator, body condition score. This is termed recommended because it has been used successfully at least once to reflect a change resulting from a dog population management intervention. And this slide shows photos of dogs that could be assessed visually to have different body conditions, from emaciated through to obese. By regularly assessing a proportion of the dog population for body condition, you can measure a change in this indicator and therefore reflect a change in the impact of improving dog welfare. Interactions between dogs is also listed as a potential indicator of dog welfare. And here we have some examples of friendly affiliative play behaviour and negative aggressive behaviour between dogs. Now this indicator is described as suggested, because although social interactions have been used successfully to reflect welfare in other species, such as farm animals, it has as yet not been used to assess the impact of a dog population management intervention on dog welfare. So in the guidance we describe how this indicator could be used and how it could be measured, but we do not have the evidence to recommend it at this time. For each indicator, there is also guidance on at least one method of measurement that could be used to collect data on this indicator. So back to our body condition score example. You can use either a questionnaire survey or a street survey to collect data on the body condition of your dogs, dependent on where you are most likely to see the dog population you are hoping to impact upon. There are 7 methods of measurement included in the guidance, and for each one there is description of a protocol and often also annexes such as example data collection forms or an example questionnaire. This photo shows a member of the NGO Spay Panama conducting a street survey of roaming dogs in Panama City. He is using a mobile phone app to record the position, gender and welfare of the dogs in front of him. There are also tools available on the ICAM Coalition website to help you train and test yourself in the visual assessment of dog body condition. So the guidance covers impacts, indicators and methods of measurement suitable for a range of dog population management interventions. This makes the guidance necessarily long so it can work for everyone. But as I mentioned earlier, not everyone will have the same impacts in mind, nor will everyone be using the same style of intervention, nor be tackling the same type of dog population. You will need to choose what is most suitable for you. So although the first chapter that provides the background and the last chapter that provides advice on making your impact assessment robust is relevant for everyone, the middle section, the filling, is up to you. In effect, we have created the Subway sandwich of monitoring and evaluation guidance. To help you select the right filling, we have also created an interactive online tool, which is also available on the ICAM Coalition website. This tool will ask you to sign up as a user, so it can store your results online for you to access them later. It will provide you with links to those essential chapters that are relevant to everyone. But once you enter the interactive phase, it asks you to select which impacts your intervention is aspiring to achieve. It then asks a series of short questions about your dogs and your intervention, providing short feedback as you go. And finishing with this dashboard, where those indicators and methods of measurement that appear most suited to you are highlighted, and at the bottom of the page a link to your tailored PDF document. A much shorter and bespoke set of guidelines, especially for you. So that just leaves me to make a plea. Please do share this guidance with others that you feel would be interested. Do also share with us your thoughts or suggestions on how we could improve this guidance in future, and any experiences you have of conducting impact assessment of dog population management interventions, so that we may learn and improve this guidance in future. You can contact us on this email or via any of the Coalition members. Their logos are displayed here to remind you who we are. And finally, thank you to the collaborating partners, subject experts and dog population management implementers that all generously provided their time and expertise to make this guidance possible. And thank you for listening.